Psoriatic arthritis is one of the major complications that's associated with psoriasis, a relapsing inflammatory skin disease. An estimated 30% of people with psoriasis will go on to develop psoriatic arthritis, another type of inflammatory disease that's caused by both genetic and environmental factors. According to the National Psoriasis Foundation, delaying treatment for psoriatic arthritis for as little as 6 months can result in permanent joint pain and damage. This is why it's imperative that people who show psoriatic arthritis symptoms receive treatment as soon as the signs develop. Much like the diet and natural treatment of psoriasis, treating psoriatic arthritis naturally involves making dietary and lifestyle changes and using pain-relieving and anti-inflammatory agents like turmeric and Epsom salts. Although seeking medical attention for psoriatic arthritis is extremely important, as the disease can cause permanent joint damage, there's complementary ways to also improve your symptoms. Psoriatic arthritis is a condition that develops when the body's immune system attacks your healthy cells and tissues. The immune response causes inflammation in your joints, and this can lead to stiffness, swelling, pain, and difficulty moving. The condition can cause permanent joint and tissue damage if it's not treated the right way. According to researchers at the University of Rome, more than half of all patients with psoriatic arthritis exhibit progressive erosive arthritis, and this is associated with severe functional impairment and psychosocial disability. Studies show that destructive changes to your bone usually appear within a few months from the onset of psoriatic arthritis symptoms, so seeking treatment straight away is extremely important. It's true that many people who develop psoriatic arthritis have a family history of psoriasis, and having psoriasis is the single greatest risk factor for the development of psoriatic arthritis. In fact, about 30% of people with psoriasis will also develop psoriatic arthritis. If you have a severe case of psoriasis, that doesn't necessarily mean that you'll have a severe case of psoriatic arthritis. On the other hand, some people have only mild psoriasis symptoms but experience pain in their joints as a result of the psoriatic arthritis. And in some cases, people develop psoriatic arthritis and don't experience any skin changes or symptoms of psoriasis at all. There's several different types of psoriatic arthritis, and the type will help your doctor determine the best treatment plan. Oligoarticular is a form of mild psoriatic arthritis and affects 4 or less joints in the body. Polyarticular is more severe and it affects at least 4 of your joints. And spondylitis is the term used to describe inflammation of the spinal column. This can make joint motion in your neck and lower back difficult and painful. Enthesitis is a condition that involves inflammation at the sites where your tendons or ligaments insert into the bones. This can affect areas of your body like the spine, pelvis, ribs, and the bottom of your feet. Dactylitis is a form of arthritis that refers to the development of inflammation or swelling in the fingers and toes. It can cause your fingers and toes to look like sausages, and it might lead to hand or foot deformities. The symptoms of psoriatic arthritis can come on suddenly or develop over time. They range from mild to serious, and if left untreated, the symptoms can develop into extensive joint damage. Usually people with psoriatic arthritis experience symptoms that worsen over time, and they sometimes have periods of improved symptoms or periods where their symptoms become more severe. The most common psoriatic arthritis symptoms include fatigue. Experiencing tiredness and fatigue is common among people with psoriatic arthritis. Research shows fatigue is caused by the presence of coexisting inflammatory conditions. This can be the result of the body undergoing stress or the adverse side effects of medication used to treat the psoriatic arthritis. Swollen and painful joints. Much like the symptoms of rheumatoid arthritis, psoriatic arthritis usually causes your joints to become stiff, swollen, and painful. They can also appear red and feel warm when touched. This can occur in one or both sides of your body. Some places where you may experience swelling and pain include your wrists, fingers, toes, knees, ankle, and lower back. You may experience pain at the areas of the foot where the tendons and ligaments attach to your bones. This is especially common at the back of the heel and the soles of your feet. Psoriatic arthritis can cause inflammation of one or more vertebral joints in the spine. This is a condition called spondylitis, and it can lead to lower back pain, and it usually becomes worse over time. There may also be inflammation and pain in the joints between the base of the spine and the pelvis. As a result of psoriatic arthritis, your nails may separate from their nail beds and become pitted. You might also develop brittle nails that break easily or split at the ends. The condition affects the joints that are closest to your fingers and toenails, and these are called the distal joints. Experiencing nail changes is one of the major indicators that the condition is psoriatic arthritis and not another type of arthritic disease. You may experience redness and pain in your eye and develop eye infections like pink eye or conjunctivitis. Psoriatic arthritis is an autoimmune disease, and it's caused by an immune response that mistakenly attacks the healthy joints and the skin. This results in inflammation, and it causes swelling, stiffness, and pain in your joints. The truth is, no one knows exactly what causes psoriatic arthritis, but researchers believe that both genes and the environment play a role. Research shows there's a strong genetic or family link to psoriatic arthritis than there is to other autoimmune disease, with about 40% of people diagnosed with psoriasis or psoriatic arthritis having family members who are also affected by the disease. Environmental factors such as viral or bacterial infections may cause the onset of psoriatic arthritis among people who already have a family history of the disease. The stress can also lead to bodily inflammation, possibly resulting in the onset of psoriatic arthritis or more severe symptoms. Some facts about people who commonly develop psoriatic arthritis. It affects people who have psoriasis even if the symptoms are mild. People with a parent or sibling who has psoriatic arthritis have a greater chance of developing the disease. It's more prevalent in Caucasians than Africans and Asians. It usually begins between the age of 30 and 50, but it can also begin in childhood. Men and women are equally at risk for developing psoriatic arthritis. There's no cure for psoriatic arthritis, but the treatment plans are put in place to control the inflammation, reduce the pain, and relieve the swelling and stiffness. Prescription and over-the-counter medications are commonly used to help to treat the overactive immune response that causes the inflammation. The drugs that are most commonly used to relieve the psoriatic arthritis include non-steroidal anti-inflammatory drugs are over-the-counter medications, and they're used to reduce inflammation, swelling, and pain. Unfortunately, there's many dangers to these drugs, including an increased risk of heart failure, gastrointestinal damage, renal disease, and allergic reactions. These dangers should be one factor you discuss with your doctor when considering the conventional treatment methods for psoriatic arthritis. Immunosuppressant medication is used to ease the overactive immune response that's causing the psoriatic arthritis. Immunosuppressants like methotrexate, cyclosporin, and Arava might help to alleviate the pain and the swelling and prevent the permanent joint damage. Some adverse side effects from taking immune suppressants include nausea, upset stomach, hair loss, mouth sores, and an increased risk of liver problems. Corticosteroids are used for their anti-inflammatory effects. They can reduce joint inflammation, swelling, and pain by suppressing inflammatory pathways in the body. Some commonly prescribed corticosteroids include prednisone, dexamethasone, and methylprednisolone. TNF inhibitors are used to treat patients who have both psoriasis and psoriatic arthritis. They can help to relieve stiffness, ease pain, relieve swollen joints, and improve skin issues. These drugs can be given by injection under the skin or infusion into the vein. Some adverse side effects of TNF inhibitors include an increased risk of infection, skin reactions at the injection site, difficulty breathing, and low blood pressure. Another conventional form of treatment for psoriatic arthritis is light therapy. This involves being exposed to a combination of natural ultraviolet light and artificial ultraviolet light. The researchers have found by targeting the skin with light therapy, the joints also respond. But according to research conducted at the University of Washington School of Medicine, light therapy is more effective for mild skin and joint manifestations. One of the biggest things you can do to improve psoriatic arthritis is to avoid eating the pro-inflammatory foods and drinks like alcohol, caffeine, sugar, and trans fats. For some people, certain foods trigger the inflammation, and these should be completely avoided. These could include gluten, dairy, and shellfish, which are all foods that commonly cause food allergies and sensitivities. Instead, stick to anti-inflammatory foods like green leafy vegetables, broccoli, blueberries, walnuts, and pineapple. You want to make sure you eat a well-balanced diet that includes good quality protein, wild caught salmon, grass-fed beef and organic chicken, healthy fats like avocado, coconut oil, and complex carbohydrates like oats, quinoa, and brown rice. You can watch my other videos on anti-inflammatory conditions and on autoimmune disease for more. If you're holding on to extra weight, this can put added stress on your joints. A 2017 systematic review conducted in Madrid, Spain, found that patients who lost weight experienced less inflammation. That's why it's important that you lose any excess weight by following a well-balanced anti-inflammatory diet and engaging in regular exercise. This can help to reduce stress, improve your flexibility, and relieve the swelling and the pain. You can check out my videos on weight loss for more. Getting regular exercise such as walking, biking, yoga, or aerobic exercise can help to improve the flexibility of your joints. This will promote the range of motion, reduce the stiffness, and even alleviate pain that's associated with psoriatic arthritis. A study published in Drug Development Research found that 77% of the participants who practiced a home-based exercise routine improved the mental and physical health. Because stress can lead to inflammation, making psoriatic arthritis worse, it's important to practice stress management. Studies show that stress is a risk factor for many autoimmune diseases because it influences inflammatory cellular reactions. Make reducing stress a part of your daily life, with activities like walking outside, practicing yoga, meditating, praying, or journaling. Any stress reliever that helps you unwind and reduce your stress can be incorporated into your day. You can check out my videos on herbs for stress relief or my video on pregnenolone for more information. Research shows that acupuncture is increasingly being used as a complementary therapy for the treatment of rheumatic disease. It can be used to relieve back pain, neck pain, shoulder pain, knee pain, and joint pain. Acupuncture works for conditions like psoriasis and psoriatic arthritis by releasing natural painkillers such as endorphins, serotonin, and adenosine. Studies also show that acupuncture, which has been used as a form of alternative medicine for over 5,000 years, is a safe means of treatment that will not interfere with any existing treatments. Instead of turning to over-the-counter painkillers that increase your risk of heart disease and gastrointestinal damage, try using natural painkillers instead. Epsom salt is considered to be a natural painkiller that works to relieve joint pain and reduce inflammation, although little research has been completed on the subject. You can add it to warm water, let the magnesium-rich Epsom salt soak into your skin for about 15 minutes. This may help to remove the scales and calm the itching, things associated with psoriasis. Magnesium supplementation is required for the activation of hundreds of enzymes. Therefore, supplementation with magnesium can benefit most health conditions after a period of time. Other effective treatments for psoriasis involve 60 milliliters of aloe vera juice taken first thing in the morning on an empty stomach, 2 grams of GLA from borage oil, up to 9 grams of omega-3 fish oils. And for spondylitis, deer antler velvet has been shown to be effective. To book a consultation or to learn about herbs, supplements and natural treatments, check out my website.